What if we could stop those serious, life-changing bone fractures before they even have a chance to happen? There's a new landmark study out that suggests we might have been thinking about bone health all wrong, and it could totally change how millions of women approach aging. So let's get into it. It really all boils down to this one simple question. See, for decades, the way we've handled bone density has always been reactive. We wait for a break or for a really bad scan, and then we act. But what if that's completely backwards? What if we could prevent that first fracture from ever happening in the first place? Okay, so to really get why this new research is such a big deal, we've got to first look at the way things are done right now, what I like to call the fracture waiting game. Think about it. The old way, the reactive way, is to treat osteoporosis once it's already a full-blown problem, usually after someone's already had a painful fracture or a scan shows their bones are in pretty bad shape. This new way of thinking, though, it flips that on its head. It's all about being proactive, about preventing that very first break.
So what exactly is osteoporosis? Well, it's an official diagnosis from your doctor. It basically means your bones have become weak and brittle, putting you at high risk for a fracture. The technical definition is a bone mineral density score, or a T-score, of -2.5 or lower. That number is the magic line where treatment usually kicks in.
And this is the crucial part you really need to pay attention to. The standard medical guidelines, the ones doctors follow, generally don't even recommend screening for this until a woman is 65 years old. Just remember that number. Age 65. It's the key to this whole story.
Because that number, 65, it creates what this new research calls out as a huge, hidden gap in how we care for bone health. It's a period of time where women are becoming vulnerable, but we're not even looking for the problem. Okay, so look at this. This is where the disconnect becomes so clear. We know for a fact that the most rapid period of bone loss for women kicks off right after menopause. We're talking usually between the ages of 45 and 55. But like we just said, we don't usually start screening until 65. That's a decade, maybe even 2 decades, where significant damage can happen completely under the radar.
Now there's a name for this in-between state. It's called osteopenia. It's not a disease, right? Think of it more like a yellow light, a warning sign. Your bone mass is lower than it should be, but you're not quite in that osteoporosis danger zone yet. For years, the approach has been to just wait and see. But this new study asks, what if it's actually the perfect window of opportunity to step in?
And that brings us to the hero of our story today. A game-changing clinical trial published in the New England Journal of Medicine that basically decided to stop waiting and start taking action. And the question these researchers asked was, it was so simple, but it was also a total game changer. They asked, if we intervene right in that osteopenia window for women who are between 50 and 60 years old, can we actually stop fractures from happening 10 years down the road? So how'd they figure this out? Well, they set up this really smart 10-year study. They took about 1,000 women who all had osteopenia and split them into 3 groups. The first group got a bone-strengthening drug called Zoledronate twice, 5 years apart. The second group got it just one time, and then a placebo 5 years later. And the third group, they just got a placebo both times. Then everyone just waited. Okay, so they wait a decade, and the results that come back? They weren't just promising. No, they were powerful enough to potentially rewrite the entire rule book for bone health.
So let's break down the results. First up, the big one. Over those 10 years, 11% of the women who got the placebo ended up with a vertebral fracture. That's a break in your spine. But in the group that got both doses of Zoledronate, that number dropped to just 6.3%. That is a huge reduction.
But wait, it gets even better. When they looked at all the major fractures, we're talking the really debilitating ones in the hip, wrist, or spine, the group that got the treatment saw a 40% reduction in risk. 40%! That is a massive drop in risk for the kinds of breaks that can really change your life.
Okay, so in medicine, there's this metric they use called the number needed to treat. It basically asks, how many people do we have to give this treatment to in order to stop one bad thing from happening? For this study, that number was just 21. And let me tell you, in the world of preventative medicine, that is an amazing number. It means this treatment is incredibly efficient. And maybe the best part of all this isn't some crazy, complicated, super expensive therapy. We're talking about 2 simple infusions over an entire decade. The drug is well tolerated by patients, and as the study points out, it's really cost-effective, about 1,500 Indian rupees per dose, which is way less than a lot of other treatments out there. So, what's the big takeaway from all of this? What does it all mean? Well, it signals a fundamental shift in how we should think about bone health. It's about moving from being reactive to being truly proactive.
And look, you don't even have to take my word for it. The study's own conclusion says it loud and clear. We should be considering proactive screening and treatment in younger postmenopausal women, instead of just waiting around for bones to break.
So really, it's a complete flip in thinking. The old way was to wait until 65, find a problem, and then react to it. The new way this study is proposing is to screen earlier, between 50 and 60, find those warning signs, and act to prevent that first fracture from ever happening.
And you know, this isn't just some dusty paper sitting in a medical journal. This is information that could genuinely change medical guidelines across the globe. More than that, it empowers millions of women to start a conversation with their doctors, to take control of their health, and to make sure they stay strong and active for years and years to come.
Which leaves us with this one kind of mind-blowing thought. It sounds almost too good to be true, but the evidence is right there. Could a simple 2-dose treatment given over a decade really change the future of aging for women? Based on this research, the answer looks like a very, very promising yes.